The main benefits of an implant is 1, improved appearance, and 2, improved function. There's no other treatment in dentistry that can provide those 2 things as well as implants. I tend to find patients, they can eat whatever they want, so there's no issues with biting an apple or a carrot or crusty bread, and teeth on implants can look just as good as your own. So that's why I would say, in my opinion, it's the best option. Well, believe it or not, in my experience, I found placing dental implants a lot more comfortable than having teeth removed, having a deep filling, or having a root canal treatment. Because essentially there is no tooth that you need to drill into, and teeth tend to be sort of full of nerves. So when we place dental implants, we're placing a titanium screw that goes into the jawbone, and the bone is nowhere near as innervated with nerves as teeth are. So in my experience again, we find it quite comfortable. After the procedure, you can feel a little bit of tenderness around the area, a bit of swelling, a bit of bruising, but within a couple of weeks that tends to subside. For any missing space, there's always 4 options. Number 1, you can leave the space. Number 2, you can have a removable denture that you take in and out of your mouth. Number 3, you can have a bridge. Or number 4, you can have a dental implant. What can happen with a missing space is that the 2 teeth adjacent to the space can start tilting in, or the top tooth can start growing down into the space. So it's always a good idea to have the space replaced. Obviously, if the space is not bothering you and you've had it missing for a long time and you haven't had any sort of tilting or drifting or the top tooth sort of growing downwards, and if you're happy with the space, then you can always leave it. But in any case, we always suggest to have something to replace the space, and obviously the best option is a dental implant. So a big question I get as a surgeon is whether smoking will affect my implants. I think there's always a risk with smoking, and it's very important for a patient to try their best to limit the amount they smoke. But in saying that, implantology and the treatment of implants and the surface of the implant has got a lot better over the years. So I would say I'm quite comfortable in placing an implant if somebody smokes between 1 and 5 cigarettes a day. A very typical question I'll get by my patients is how long will the implant last? And I always tell the patient that if the clinical side and the treatment is done well by the clinician, and if the patient sees the dentist once every year and sees the hygienist once every 4 months, then it can possibly last their whole entire lifetime. But what we tend to see is that after a few, 3, 4, 5 years, patients sort of start to come to the hygienist less and less. So if the patient can commit to seeing the dentist and the hygienist regularly and clean it as best as they can, it can last them many, many years. With all dental implants, it is something artificial that's placed inside your bones, so it's not a case of placing the implant and then forgetting about it. As a surgeon, it's my duty to inform my patients that it's absolutely necessary to maintain that. So we always ask our patients to come and see the hygienist at least once every 4 months to clean and to go over oral hygiene instructions. And then I like to see my patients at least once every year to take x-rays and just to know that everything is okay with the implant. With other procedures in implantology, for example, if we're making a denture that is supported by implants, you can obviously get a bit of wear and tear on the denture, so it may need replacing after a certain amount of years. But generally, if you've got a crown on an implant, that should last you many years. As with any surgical procedure, there are risks. I think when placing an implant in the lower jaw, there are nerves that we need to be careful about. So it's absolutely mandatory that we take something called a 3D scan before we start your surgery. So I can measure exactly where the nerve is, how wide and how long the bone is. And then we can pick the appropriate implant to ensure that it's nowhere near your nerves. The cost of implants can be spread over 1, 2, 3, 4, or even 5 years. And we can offer options for interest-free as well. So that makes it a lot more comfortable for our patients. And the benefits of that is that they can have the treatment straight away and just sort of pay monthly payments for as long as necessary.